Hi, I'm Shannon, a registered vet tech at Cats Only Veterinary Clinic, and I'm going to be showing you how to administer subcutaneous or sub-Q fluids with the help of one of our patients here. First thing you're going to want to do is get all of your supplies out and ready to go. Having 1 or 2 large towels handy can provide comfort for your cat and restraint if needed. Having food or treats ready can provide a good distraction for your cat and makes this a more positive experience for them. Next, you're going to want to get your fluids ready to go. Gravity is going to be your best friend when doing sub-Q fluids. At home, you can simply hang the bag on a hanger using a door or cabinet to get the height you need. The higher, the better. Next, you're going to want to connect the line to your bag. Simply pull the plug off the end of the bag and the cap off the end of the line, being careful to keep these ends clean and do not touch them to anything else. Simply push and twist firmly until the line is all the way inserted. And next, you're going to need to run the air out of the line. Take your roller clamp, move it up, and that will start the fluids flowing. Once you finish flowing the fluids through the line, roll it down to stop the fluids, and then you can attach your needle. Once you expose both the end of the line and the end of the needle, again, be careful to keep these clean and do not touch them to anything else. You're going to want to note the fluid level in your bag before you begin and where you will stop. These numbers here indicate increments of 100 milliliters or mils, and the marks in between indicate 50 mils. Carmen here is going to be getting 100 mils of fluid. Next, you're ready to actually get your cat. You're going to want to choose a place that's most comfortable for them, whether it's a table or countertop, in your lap or on the floor, whatever works best for them. And be sure to have those distractions handy. This is Carmen, one of our patients here at Cats Only Veterinary Clinic. Sub-Q fluids go in the space between the skin and muscle, and this is best done in areas of loose skin, so in a cat in the shoulder area here, or you can also do it off the sides of the hip. When you're ready to start, simply tent the skin into a triangular shape, and you can feel with your finger in the center of that tent where the needle will go. When you're ready to poke, carefully uncap your needle and insert it with a quick motion, being careful to keep it parallel to the body. As you do this, you can gently scratch or pet, or again, distract with those treats. Once the needle is inserted, move the roller on the clamp up to begin the flow of fluids. If your line has been clamped for a while, you may need to move your roller and unpinch the line to begin the flow of fluids. If at this point you see fluids leaking outside the body, it means that you have pierced through the skin. Simply back the needle up into the sub-Q space and keep going. You can watch the drip chamber here to see how well your fluids are flowing. If they aren't going very fast, some minor adjustments to your needle will help by tipping it up or down or side to side, or you can also lift the skin. I like to hold the line against the cat, helps me steady the line, and also make sure that the needle doesn't fall out. Once your fluids are given, simply roll the clamp down to stop the fluids. Gently pinch at the point of insertion with the needle and remove the needle. Continue to hold off on the skin for a few more seconds to help close up that hole. Once you let go, if you notice any fluids leaking out or you notice a blood tinge to that fluid, that's okay. This is all normal. There are some small blood vessels in the skin that can be nicked. Simply wipe away the extra fluid. You're going to want to be sure to change your needle between uses. The needle becomes dull and is no longer sterile. You'll notice after you're done that your kitty will have a small fluid bubble under the skin. This too is normal. If at any point during this your kitty becomes a little bit squirmy, you've got that extra towel handy that you can use to help restrain. I like to keep a hand over the back of the neck and on the hips to help keep them still. If you have an old towel handy, you can cut a small window into that towel and place it over your cat, which will allow you to restrain and still have access to the area you need. Once you're all done, be sure to reward your cat for their good behavior and to make this a positive experience for them, and that way it's easier for next time. I hope this video has helped you, and if you have any questions or concerns, please contact your veterinarian.